That got us wondering, is it time to update what's happening with COVID cases and hospital statuses in our area? Casey Nolan spent the night looking at some data. And Casey, you noticed a rather interesting trend when it comes to our local hospitals, right?
Yeah, that's right. And there's a lot of good news in the COVID stats right now, especially compared to this time last year. But one pandemic-related problem at hospitals is not getting any better. First, the good news. The warnings of a so-called triple-demic of RSV, COVID, and flu viruses no longer apply. Doctors say that passed when RSV peaked late last year. Holiday COVID cases seem to have peaked too in the D.C. region over the past 10 days or so. And COVID cases are way down from this time last year. Right now, Maryland hospitals have about 600 COVID patients statewide, and there are around 800 in Virginia. In January of 2022, both states had roughly 3,500 daily COVID patients.
But that doesn't mean that our hospitals are out of the woods.
And that's the bad news, says Bob Atlas with the Maryland Hospital Association.
So we've got front-end issues, back-end issues, and issues in the middle, which is where the hospitals lie.
First, flu cases are still up and staffing levels are still down across the healthcare system. At the same time, Atlas says more people are seeking care, some for issues they put off during the pandemic, some for issues caused by it.
People's mental health has been affected in ways that are yet to be really fully understood. And that is showing up in our hospitals.
Which all adds up to crowded hospitals. Across the region, while COVID cases have dropped, in Maryland, Atlas says 92% of available hospital beds are full.
We're also pretty sure that life is not going to be back to pre-COVID times ever.
Both Maryland and Virginia are trying to recruit more people to work in healthcare. But of course, that's a long-term fix. In the meantime, Maryland hospitals are spending about 5 times more a year than they did pre-pandemic on travel nurses and other contract workers to fill the gaps. We're talking, Leslie, about hundreds of millions of dollars that the Hospital Association says is just not sustainable.
And, you know, we thought that was happening in small rural towns, but no, it's happening everywhere.
Everywhere.
All right, Casey, thank you.